Hello, my name is Megan Robertson, and today I would like to address with you the issue regarding mandating childhood vaccines in order to protect the vulnerable. Today I would like to tell you a story about a man named Jacob Adeshek. He is a cancer survivor and is immunocompromised as a result of a life-saving bone marrow transplant. He was fully vaccinated before his transplant. However, afterwards he builds no response to vaccines and cannot be given any vaccines with live antigens in them. He is not alone, as many chemotherapy patients and those with chronic conditions being treated with immunosuppressants share in his dilemma. Herd immunity is his only protection. He overcame the unfathomable, beating leukemia. He fought to stay alive, not to hide. The anti-vaccination believers have hopped on the bandwagon driven by falsehoods and are on a crash course for destruction, with Jacob as the potential victim. These anti-vaxxers increase the probability of the public catching illnesses and put Jacob's life at risk every day with no viable alternative. Jacob has devoted his life to helping others as a medical professional. He has armed himself with much accurate knowledge and education with the hopes of getting the right facts in the hands of the public. One can only hope that a rational, ethical choice is made concerning the mandation of vaccines. Recently, as a nation, we have seen a resurgence of vaccine-preventable outbreaks such as measles and pertussis due to vaccine fallacies being presented to the public. Under-immunization presents potentially life-threatening diseases affecting the vulnerable populations such as the infants, elderly, and immunocompromised individuals. Clinicians, policymakers, and other professionals must step up to do what is best for our society by mandating childhood vaccines to protect these vulnerable individuals. Per the CDC, vaccination is one of the greatest life-saving developments in human history. Vaccines are available for 18 dangerous and deadly diseases. Over the years, these vaccines have prevented countless cases of disease and saved millions of lives. Polio, for example, is a crippling disease that can be deadly. The virus spreads from person to person and can invade an infected person's brain and spinal cord, eventually causing paralysis. Since the initiation of the polio vaccine in 1955, the U.S. has been polio-free since 1979. However, polio is still a very real threat in other areas around the world. Thousands of years ago, the smallpox virus emerged and began causing illness and death, ravaging the human population. Smallpox is a highly contagious virus that presents with a rash starting in the mouth and tongue, and eventually within 24 hours spreads to the entire body. Smallpox killed 1/3 of its victims and caused more than 300 million deaths in the first half of the 20th century alone. As of 1980, the World Health Assembly declared smallpox eradicated, and no cases have occurred, thanks to the help of the vaccine. The CDC estimates that vaccinated children born between 1994 and 2016 will prevent 381 million illnesses, which is more than the current population of the entire United States. Vaccinations help to avoid 855,000 deaths, and vaccines will save nearly $1.65 trillion in total costs. Vaccines can protect future generations. Vaccinated mothers can help to protect their unborn children by receiving the rubella vaccination. Rubella accounted for, in the past, 11,000 deaths in infants as well as 20,000 birth defects. However, we cannot forget that the preventable illnesses continue to ravage and kill large numbers of people around the world. Measles continues to remain responsible for many childhood deaths ages 5 and under in different areas throughout the world. Here in the United States in 2014, we dealt with an outbreak of measles in a popular California amusement park that spread to Canada and Mexico. This event shed light on U.S. childhood immunization practices. A study later attributed the outbreak to under-immunization. Pertussis cases have also been on the increase in the United States since the 1980s. In 2012, 48,000 cases were reported, which was the most reported cases of pertussis since 1955. While we have made monumental strides over the years to improve overall health in the United States and around the world with the development of these vaccines, it is pivotal to understand why these vaccines are safe and an effective way to prevent illness in our societies. Vaccines are a safe and effective way to treat and prevent the spread of disease and illness. The United States' long-standing vaccine safety program closely and constantly monitors the safety of the vaccines. The United States has the safest, most effective vaccine supply in history. Scientists ensure the safety of the vaccines by conducting different types of studies. Clinical trials are studies conducted before the vaccine is made available. These studies are carried out by the vaccine manufacturers as well as the FDA to make decisions about whether a vaccine is safe effective, and ready to be licensed. Post-licensure studies are conducted after a vaccine is approved by the FDA and is made available to the public. These studies continue to monitor the vaccine's safety and look for rare adverse events that may occur. Vaccines are required to have at least 10 years or more of extensive testing before they are licensed and distributed. After vaccines are approved for use, continued monitoring by the CDC and FDA and other various programs occur. Common side effects of each vaccine are identified prior to licensing. The Vaccine Safety Data Link, or VSD, is a collaborative project between the CDC's Immunization Safety Officer as well as 8 other healthcare organizations. The VSD started in 1990 and continues today in order to monitor the safety of the vaccines and conduct studies about rare and serious adverse events following immunization. The National Childhood Vaccine Injury Act requires all healthcare providers to give a vaccine information sheet, or VIS, to each person receiving a vaccine. This helps to ensure that everyone understands the benefits and risks each vaccine may have. Ingredients in vaccines are safe and play a necessary role in the vaccine. Ingredients commonly used in the production of vaccines include a suspending fluid, which may be sterile water or saline, preservatives, which could be albumin, and adjuvants or enhancers, which help improve the vaccine's effectiveness. Antigens can be alive or killed within the vaccine. They stimulate the body's immune response to make antibodies to protect against infection. The most commonly used adjuvant in vaccines is aluminum and has been included in vaccines for more than 70 years. Aluminum helps to increase the body's response to the antigen. However, controversy still remains regarding aluminum salts in vaccines due to concerns about potential side effects. Aluminum is abundant and is in everyday thing you can think of, such as food, water, air, even in breast milk. The amount of aluminum that is contained in vaccines is less than the amount in an infant's daily volume of formula. Paul Offit, a well-known MD, stated that children are exposed to more bacteria, viruses, and toxins and other harmful substances in one day of normal activity than what is in a vaccine. There are many advantages to using adjuvants in vaccines, which include less number of doses required to achieve effective immunity and enhanced effectiveness in the very young, old, and immunocompromised individuals. Side effects in vaccines are extremely rare. Per the CDC, the most common side effects from vaccines include site soreness as well as a low-grade fever. Serious adverse reactions such as anaphylaxis is extremely rare, occurring in less than 1 case per million doses administered. You are 100 times more likely to be struck by lightning than to have a serious allergic reaction to the vaccine that protects you against the measles. There is no credible correlation between vaccines and autism. Sadly, a study was published in a paper in the UK claiming that the MMR vaccine caused developmental delays in children. After an investigation into the study, it was found the results were utterly false. Many things were fraudulent regarding the study, including small sample size and scientific fraud, as the research was being paid for by a lawyer who was bringing a class action lawsuit to the manufacturer of the MMR vaccine. Unfortunately, the damage had already occurred, and many people had already believed these results that were posted. We must remember, benefits of the vaccine far outweigh the risk of the actual disease it can create. For vaccines to work effectively within a community, herd immunity needs to be achieved. This means sufficient people must be immune to a disease so an infected person or carrier is unlikely to encounter someone who has no immunity. Vaccination coverage rates to adequately provide herd immunity depends on the infectiousness of the disease. For example, measles is highly contagious. One infected individual can spread it to 20 other individuals. The World Health Organization recommends 93 to 95% vaccination cover to provide herd immunity against measles. Pertussis is a specific case in itself in that immunity fades over time, and if vaccination rates in the community fall, people who have been vaccinated become more susceptible. Vaccination programs become a social contract in which individuals are vaccinated in order to protect the community as a whole from a possibly life-threatening contagious disease. States do, however, allow medical, religious, and philosophical exemptions regarding vaccines. Currently, there is no U.S. federal law that exists regarding vaccinations. State laws are established vaccination requirements for school-age children, both public and private, as well as certain daycare facilities. Each of the 50 states have laws requiring children to be vaccinated against DTaP, polio, measles, and rubella prior to entering the facility. States do, like I said, allow for certain exemptions, such as medical, religious, and philosophical reasons. This does, however, vary from state to state, and forms must be completed by a medical professional as well as a parent or guardian. In conclusion, we must remember the key fact to herd immunity within a community is that most of the population must be vaccinated to protect those vulnerable individuals who cannot receive vaccines. We cannot allow fallacies regarding the dangers of the vaccine to cloud the public's vision. As stated previously, as a nation, we have seen a resurgence of vaccine-preventable outbreaks, such as measles and pertussis, due to vaccine fallacies being presented to the public. Under-immunization presents potentially life-threatening diseases affecting vulnerable populations. Clinicians, policymakers, and other professionals must step up to do what is best for our society by mandating childhood vaccines to protect those vulnerable individuals. As Jacob Adeshik stated, our best shot at staying safe is in the hands or a shot into the arm of our community. Thank you.